As we said that the type 2 diabetes is usually asymptomatic and may present with complications like ischemic heart disease, coronary vascular disease, or cerebrovascular accident, peripheral vascular disease, and genital infections, or any type of microvascular complications like retinopathy or neuropathy or nephropathy, which is called sometimes cryopathy. Hyperlipidemia also may manifest in patients with type 2 diabetes, like skin manifestations are rare, like arcus lipidos or hyperlipidemia in the skin, like exanthema and xanthelasma. And this figure shows few symptoms of diabetes. The patient may present with hungry or sexual problems, vaginal infections like candida albicans or melanitis if the patient was male, frequent urination. The wounds in diabetes usually have delay in the healing and sudden weight loss. The patient may have thirst, which is called polydipsia, or he had blurred vision. And patient with type 2 diabetes, as we said, that he is usually asymptomatic, but if we dig in the history, he may give us the history of tiredness. Diagnosis. Few points about few terminology or terms you will may face during reading the diabetes methods in your textbook. When you read the fasting blood glucose, it means that the patient fasts for at least 8 hours. Drinking water is approved. Run the blood glucose means that we test for the glucose in the blood at any time of the meal, whether 2 hours, 3 hours, or etc. Postprandial glucose, it means that 2 hours, which is a preferable time for measuring and follow up patient with diabetes. Oral glucose tolerance test now is rarely needed in the practice except in case of gestational diabetes or impaired glucose tolerance. Lipid profile, the patient should fast at least 12 hours. If we withdraw the blood from the venous source, the glucose would be less than the capillary and the whole blood would be less than the plasma. If the random blood glucose or the fasting blood glucose was high, it is preferable to repeat the test if the patient was asymptomatic. But if the patient have symptoms, the first reading is enough for the diagnosis. This table show the blood test levels for diagnosis of diabetes and the term which is called pre-diabetes. Usually we may use the HbA1c, which is written in percent, or the fasting plasma glucose milligram per deciliter, or the oral glucose tolerance test, which also equal to the postprandial glucose or the random blood glucose. So if the patient has 6.5 or above HbA1c or his fasting plasma glucose was 126 or above, or his postprandial glucose was 200 or above, the patient regarded as diabetes. If the patient has HbA1c less than 6.4 or his fasting plasma glucose less than 100 or his postprandial glucose or the random blood glucose 139 or below, the patient is normal. Any figure between these two figures is regarded as prediabetes or also called impaired glucose tolerance test or also called impaired fasting glucose. Some criteria for testing for diabetes in asymptomatic adult individuals. Testing should be considered in all adults who are overweight, and you know the term BMI, which denotes body mass index. If the body mass index of the patient was more than or equal to 25 kg per meter square, and we have also additional risk factors like physical inactivity or first degree relative with diabetes, or high risk race like African American or Latino or the Native Americans or Asian American. Any woman who delivered a baby and his weight was more than 4 kg or were diagnosed with gestational diabetes mellitus. If the patient also have hypertension or any treatment for hypertension, if his HDL cholesterol level was low or his triglyceride level was high, and women with polycystic ovarian syndrome or as a patient have A1C more than or equal to 5.7%, or the patient have impaired glucose tolerance or impaired fasting glucose on previous testing, and any other clinical conditions associated with insulin resistance, like severe obesity or some skin manifestation which is called acanthosis nigricans, which appear like as a velvety hyperpigmentation in the area of the back of the neck and in the axilla also, or the patient has history of cardiovascular disease. All these categories should be tested for presence of diabetes mellitus. In the absence of criteria, which we talk about it, the testing for diabetes should begin at the age of 45 years. If the results were normal, testing should be repeated at least at a 3-year interval with consideration of more frequent testing depending on the initial results, like those with diabetes should be tested yearly and risk status. The patient can measure his random or fasting blood glucose in the home by a a tool or instrument which is called glucometer, and usually nowadays it is present in most of our homes. But these glucometers are not used for diagnosis, they are used for the follow-up of the patient. Patients with diabetes mellitus develop dyslipidemia, which means that the patient have high triglyceride and high LDL and high VLDL and may have low HDL. And these constellations of criteria called dyslipidemia. HbA1c measured by chromatography, and it is used for diagnosis and follow-up also, but it is not valid in many conditions like hemoglobinopathies, renal failure, pregnancy, usage of alcohol, hot or cold weather, and usage of vitamin C and aspirin. HbA1c can be measured twice per year usually, but may be measured up to 4 times per year or more, according to the situation of the patient. General urine examination may be beneficial for the diagnosis and supportive diagnosis in the patient with diabetes mellitus. Glycosuria most commonly may be caused by other factors other than diabetes, like young age, pregnancy, peptic disease, hyperthyroidism, and gastric surgery. Ketone in urine, or what is called ketonuria, also may be present in patients with diabetes or patients with diabetic ketoacidosis. Sometimes may be caused by fasting, pregnancy, vomiting, exercise, and diet rich with fat. Both glycosuria and ketonuria are not used for the diagnosis, but they are used as a supportive tools for the diagnosis. General urine examination better than 2 hours after meal and at the early morning. Some components of the comprehensive diabetes evaluation. During physical examination, we may concentrate on the height and the weight and the body mass index of the patient. Blood pressure determination, including the orthostatic measurement, were indicated. Fundoscopic examination, eye examination for presence of features of retinopathy, it is preferable done by the ophthalmologist. Thyroid examination for presence of goiter and skin examination for acanthosis nigricans as we described it previously, and insulin injection sites for presence of lipo or hyper or hypoatrophy. Also, a very important part of the physical examination is the comprehensive food examination. We use inspection for presence of any decoloration or depigmentation or any wound or ulcer, palpation of the dorsalis pedis and posterior tibial pulses, and presence or absence of patellar and Achilles reflexes. Determination of proprioception, vibration, and by monofilament sensation also may be. The laboratory evaluation for patients with diabetes, the most important one is the HbA1c or A1c or the glycated hemoglobin. If the results not available within the past 3 months, if not performed or available within the past year, also it is preferred to be done. Fasting lipid profile, including the total cholesterol, LDL, HDL cholesterol, and triglyceride. Liver function test and test for urine albumin excretion with spot urine albumin to creatinine ratio, which is called also the ACR, is important for the early diagnosis of nephropathy. Serum creatinine and calculated GFR used for the measurement of the renal function. Thyroid stimulating hormone in type 1 diabetes or patients have dyslipidemia or women over the age of 50 years, it is preferable to be done also. When we refer the patient with diabetes mellitus, we refer the patient for eye care professional for annual dilated eye examination and also for family planning for women of reproductive age. Registered dietitian for medical nutrition therapy, diabetes self-management education by the diabetes nurse, which is a very important part in the diabetes team. And also, we can refer the patient for the dentist for comprehensive periodontal examination. If needed, we may send the patient with severe depression